Hi, this is Mark White from Idaho Estate Planning, and welcome to another one of our podcasts. Today, we get the privilege of talking to some of the great ladies from Blue Cross. And I'm not even sure where we got the name Blue Cross, and maybe they can address it. Maybe they're like me going, no, we just inherited it. It's Blue Cross. But we're going to talk about a very specific program today. And so I'm going to try to introduce Kristen Tracy. All I know is that she's an engagement manager. And it's not what you think it is. It's not about getting people engaged, because if it were, I would have engaged her services earlier for a daughter who still needs to be engaged. Other than that, she can tell us what it is that she does, and then she'll introduce the other ladies with us today. All right, so Kristen, go ahead.
Happy to roll with this. Yes, so my title is actually at Blue Cross of Idaho. I am, my title is the Government Programs Engagement Manager. And I work in the community mainly at Blue Cross of Idaho. I work with dual eligible individuals and key stakeholders.
Wait. What does that mean, dual eligible individuals?
Great question. Thank you. See, I just start hammering out stuff. Dual eligible individuals.
You're going to find out what I don't know. So I'm asking the question.
I'm glad you did. Thank you. Yeah. Dual eligible individuals are individuals who are on Medicare and are on Medicaid. So they have their coverage through those two systems. And that's a very general term, as we'll come to find out as we have this discussion. And we're going to talk about a small segment of the dual eligible population. It's specific to Idaho. But with regards to Blue Cross of Idaho and what I do, I'm in the community again, and just really do a lot of education and outreach. And I've got some counterparts throughout this state that also perform the same duties. So I am really not within the walls of Blue Cross of Idaho. I'm out there in the community, but we do have two fantastic women with us today that operate here within the walls, and they help oversee care coordination. And I'm not going to steal their thunder about care coordination, but let me introduce you to these ladies. They can speak to it much better. We've got Sophie Loya, who is here, and she is a care coordination supervisor. Sophie, did I get that right? Supervisor?
So Megan and I do share the same title. We have a duals manager title.
Okay, thank you.
Right, are here at Blue Cross.
I figured I would get that wrong. At managers, yes. So, and Megan Kelly, who is also here, is also a duals manager for care coordination. And they oversee the quality of care coordination. They ensure that our members are getting their needs met. And they also work with quite a large care coordination team that is peppered throughout the entire state of Idaho. One thing that is very important to Blue Cross of Idaho is that our services are local to people where they live. And we'll probably get into that more as we go, but that's an introduction of who you're seeing on the screen right now.
Okay, very good. Thank you very much. You didn't address where we got the name Blue Cross.
I'm going to leave that up to Sophie or Megan.
And they're looking at me doing the same thing. I don't know that there's an answer. I'm sure there's a history. I just always wondered, and I had you here, so I asked the question.
There is a great article, I guess you could call it, on our website about the company history and how it kind of evolved over time. But we officially became Blue Cross of Idaho in 1973.
Oh, goodness.
Being a Blue Cross Blue Shield Association member, we became Blue Cross of Idaho Health Service in 78 and have just been Blue Cross of Idaho since that time.
All right, very good. Now, I think everybody knows that under that term Blue Cross of Idaho, we're talking fairly specifically about medical insurance. And the ability to, and I think this is what care managers address, is making sure that we're optimizing, getting the most that we can available to those folks who are your members. That is, people that are insured under Blue Cross of Idaho. Did I get that right or close?
Yeah, so I think that's a great starting point. Optimizing a member's benefits, making sure that they're aware of what they have access to for, the premium that they're paying to have this medical insurance is a large component of care coordination or case management. Separately, we also really help to identify members that have, acute or chronic health conditions and really need some help navigating those systems and getting the care that they need to maximize those benefits. So really encompasses just making sure that they get their needs met in a variety of ways.
Well, I think everybody recognizes that medical care is fairly sophisticated these days and also quite specialized, especially when you get into certain areas. And those of us that aren't in those waters every day don't know how to swim. And so being able to access somebody that can guide us through that is huge. And I'm guessing that's what you guys do, help us to navigate that.
Yeah, I think that sums it up really well. Like Kristen mentioned, Sophie and I manage the care coordination aspect of our membership, our dual eligible membership here at Blue Cross. And so that is a benefit that's part of the members' Medicare and Medicaid benefits. They can connect and engage with a care coordinator, and that's essentially what that care coordinator does, is really connect with that member and help them navigate, like you said, sort of swim in those deep waters of medical and Medicaid services.
Very good. Now, just rolling back quickly, Medicare, Medicaid, I think both passed legislation under President Johnson in 1963, and whoever named them should be shot. I'm just saying that because Medicaid, Medicare are so similar in name that so many people get them confused. They don't understand what one does and what the other one does. So if I can back up just a little bit, Medicare, you qualify for the most part when you turn 65, and it's not needs-based. If you turn 65, you qualify. Get that right? Is that about right?
I think that covers a part of the population, especially the dual eligible population that we're serving every day. A large majority of those members have qualified for Medicare and are under the age of 65 because they have some sort of disability. That's
Got it. Thank you.
To that qualification.
Yes, that's a very big clarification on this, because Medicare is available to many others that have particular needs, and then they qualify because of the health needs that they have. So Medicare does extend that coverage to folks under 65, but not to everybody under age 65. And Medicaid is not really age dependent. That's more of a needs-based program. And to qualify, you have to meet certain income and asset limitations. And so the concept here, if I understand it, is that someone who qualifies for Medicare, not necessarily over the age of 65, and someone then with that meets the qualifications of Medicaid, we're trying to coordinate that. I'm guessing the idea is we're just trying to get the most bang for the buck. And if we can coordinate those two programs, it saves us all a little bit of tax dollars because we're just more efficient with what we're doing. Does that sound about right?
Yeah,
I completely agree. Yes, I think when I look back at the history of coordinated care and why DSNPs have come about, there were really three goals: is to bring that coordination together between those two systems, Medicare and Medicaid, and to ease that navigation process for the member, and also to address some of those high expenditures. And that's really what Sophie's and Megan's teams do.
Got it. Well, we know in Idaho that the state legislatures had their struggles with Medicaid and expanding its, availability. And so anything that we can do to make it more efficient, I think, is in our best interest.
Yeah.
As well as in the best interest of a number of folks that qualify on both sides. So give me an example of a situation where we'd have the dual eligibility and then the coordination that we need to do that. Have you got one that you can talk to?
I think a really simple example, which is very challenging for a lot of our members to navigate, is just from a provider network aspect. So specific, doctors or other agencies that are providing services to a member may choose to accept Medicare assignment. And, because they're covered under Medicare, they can access services through that provider. But that network of providers through the Medicare side may not actually be the same on the Medicaid side. So that provider or that facility or agency, may have chosen not to become an Idaho Medicaid provider. So there's just even at that very basic level, some real challenges in getting the care that you need and having it be comprehensively covered from a financial aspect. So, navigating, two directories, ensuring that you're in network, that maybe you have a referral on the side of Medicaid. With traditional Medicaid, you have Healthy Connections referrals, can be really complex for a member to navigate if they don't understand it, or if they just have low health literacy in general. And that can become very cost prohibited. It can impact their overall experience in receiving that care. It can make it very frustrating. If it's very challenging, they may just not access the care that they need, which is going to really affect their health over the life of like a specific condition. So,
Well, and I think it relates to the concept of preventative care as well. That is, if we can promote and maintain health, now it's going to be more effective in the long run, right? Instead of waiting until we're at this point where we need, more invasive or more expensive care, if we can get started sooner. Mm-hmm. Does that make sense?
Absolutely.
Am I talking sense? That
And
could be the first time.
I think you really hear that over the past year, as access to preventative services has been limited due to COVID and its impact on public health and the availability of services. We've really seen a lot more narrative and conversation in the medical community about how important it is that, in relation to, an aggressive breast cancer, if you're not able to get in and get a mammography in time where they could catch it and it progresses over a year or two, it can really impact what treatment you can receive and obviously your quality of life and whether you're going to be able to beat that condition and, receive the right treatment.
Okay, so maybe we should jump into a case study, if you will, and kind of walk through that. For example, how would somebody access this? And what is it that they need to know? Or who is it that they need to know in order to, access this program and get this kind of help?
So I think one of the awesome things about the program that we offer for our dual eligible members is that they don't necessarily have to initiate anything. So every time we have a member enroll in our plan, they are assigned to a care coordinator. And that care coordinator is initiating outreach, trying to connect, engage, build that relationship with them. And the member can always opt out. They can refuse to have that relationship with a care coordinator. And there's certainly members that we aren't able to get a hold of. They just don't ever pick up their phone or return our voicemails of that engagement. But we are proactively outreaching to our membership and trying to engage them, regardless of what information we have around their health conditions or what their needs may be. We really want to engage with as many members as possible. So we do that when they initially enroll in our plan, and then ongoing, depending on their specific needs, would kind of dictate the type of support that we offer over time.
Okay, so let's get really specific. When you say they enroll in a plan,
Yes.
what do we mean?
That's a great question. Kristen, do you want to take that one?
I'm happy to, because that's part of the area that I work in, Mark. So in the community, I will, provide outreach to those individuals that are dual eligible. And part of my role is to, first of all, explain that our plan, the True Blue Special Needs Plan, the DSNP plan, covers both Medicare and Medicaid. They actually keep both of those plans, and it's just coordinated and administered at Blue Cross of Idaho. So it's right here under our roof. But they don't ever lose those benefits. That's one thing that's very critical, that it's a piece of information that we need to make sure potential members or anyone who's a dual understands, that they don't lose anything by subscribing to one of these plans, because it's a much better way to go. So we work on that educational piece. And then members can enroll in multiple ways. They can work with one of the outreach specialists. We do have brokers that work with dual eligibles to enroll them in the plan, and it's no cost to the dual eligible to do that. They can also go to our website and sign up, or they could call customer service and sign up. And the criteria really is that you have to be enrolled in Medicare, Medicaid. You have to you have to be 21 years old or over, and you have to live within one of our service counties. So we cover 30 counties right now in Idaho. As you know, Idaho has 44 counties, so we've got great coverage, and we're always looking at hoping to expand, and just and hopefully the end goal will be that we cover the entire state of Idaho.
So this presumes that they know that they are dual eligible, meaning that they've applied for Medicaid and they've applied for Medicare. So they know this already.
Right.
And you try to track them down and talk to them. And that sounds bad, because we're in Idaho and people don't like to be tracked down. You try to reach out, you try to engage them. There we go. That's a great term. I wish I had thought of that. And then give them some help in education. First of all, saying, well, listen, we have services available to you. And then, are they worried about cost? Is this something they're going, I don't want to do it because it's going to cost me money?
I think people are fearful that it does cost them money, because they're coming from this system where they don't have to pay. Medicare is usually a primary payer, and Medicaid is a secondary. And that's the same when they transition to this plan. No costs increase. The only costs that are there usually are a share of cost, and that occurs typically within traditional Medicare and Medicaid anyway. So
they're already there with that one.
Yeah. According to our contract, we can't increase any of those costs.
Okay. So
it's a zero premium, zero deductible plan.
Go ahead. Sorry.
I would add, Kristen, as well, I think that we have a really great partner in the Idaho Department of Health and Welfare, and
Yes.
They have done a significant amount of education historically and ongoing to those Medicaid members that they've identified are duals and would otherwise qualify for this plan but haven't chosen it, and providing that communication, whether it's correspondence that they're mailing. They've previously done statewide town halls to really help members understand that this is available to them. So I think that's been another great avenue. I think back to your point, Even though a member may have Medicare and Medicaid and be a dual, they don't know that, and they may not know what that means and what's available. So there is a lot of proactive outreach on our part, but also I think on health and welfare's part to make sure that people know that this is an option within the communities.
Very good. Megan,
And
you're
I
not
would add
talking
too-
enough. Oh, thank you. I was just going to say you're not talking enough, so thank you.
No, I would just add another detail as well that I think is unique and also very amazing about our plan is that once identified and members who dual eligible participants that have decided to enroll with Blue Cross of Idaho for this plan, they can enroll at any time. There is no open enrollment period. So our enrollment onto our plan occurs every month. So again, kind of connecting the dots around that awareness of that eligibility, and then that choice to enroll in this plan can happen whenever the member chooses to on a monthly basis.
Okay, so just so people understand, what's the downside to this program? There's got to be a drawback. What's the drawback? The trick question.
Well, I'm biased, so I don't think that there's a downside, but there are a couple of considerations that we want individuals to take into account before they sign up for a fully integrated plan. First and foremost, we want to ensure that their doctors are within our network. Blue Cross has a large network, but if they've got a great doctor that's not in the network, then we want to work with them to make sure that they're aware of that. And the same thought process with their medications. So we have a formulary, and we want to ensure that the medications that they're currently on are on that formulary. Those are really the two big sticking points that we make sure that there aren't any roadblocks there. So an engagement specialist can do that. A broker who's certified with DSNP can help somebody look all of those things up, or you can actually go online, and we have a search tool on our website, and you can look at a formulary, or you can look at all of our doctors that are in network.
So let's say that you're working with someone whose doctor is not in the Medicaid network. What are the options? They're just going to opt out of the Medicare portion of this and stick with Medicaid, or is it vice versa? What are their options if they don't jump into this program?
So I think it's probably important to call out that for the MMCP, for our True Blue Special Needs Plan, it's fully integrated. We're not separating the Medicare and the Medicaid. So because it involves enrollment on the Medicare side, it's completely voluntary. So if they ultimately decide that, this isn't the right choice for them because this doctor that they see, very frequently isn't in our network, and maybe we've identified that it's they're not willing to contract or just don't want that option, they don't have to sign up ultimately, and they could remain with traditional fee-for-service Medicare and traditional fee-for-service Medicaid. There's kind of some outliers that we really haven't spoken about just yet. We've focused on our True Blue Special Needs Plan, which is where their Medicare and Medicaid are fully together. We also offer a Medicaid-only managed Medicaid product for this dual eligible population. So, and this, I think, is where a lot of the support from the state comes in. If you live in specific counties throughout Idaho, the state will auto-enroll you, at least your Medicaid side, with Blue Cross, or there's another health plan in the state that operates this as well. So if you do happen to be, let's say, in Ada County, where this is an option that the state has facilitated and rolled out. If MMCP isn't the right option for you because, again, your doctor's not in the Medicare network with us, or you take a drug that's not on our formulary and you want to continue to take that and have it covered, you don't have to sign up for MMCP. But the state, Idaho Medicaid is going to at least give us, or the other health plan payer, the Medicaid side of your benefits to manage separately.
Mm.
So depending on which county you live in kind of defines your ultimate choices throughout the state.
Okay, so let's say that I'm an old guy with a white beard and no hair, and somebody says, you're dual eligible, you should sign up for this True Blue special needs plan. Why? Tell me why I should do that. Let's just get very specific of what the benefits are to me. I mean, other than have one of you three ladies come to the house and visit with me, you know, and bring coffee or something, what are the benefits? Let's talk about that.
I can give you a really super high level, and then I'll let Sophie and Megan speak to some more details.
Okay.
But I would encourage you to sign up first and foremost for just ease of navigation. To bring everything under one roof. You will have one contact person at Blue Cross that will know your history and know your background, so you can call them with questions or concerns. With our plan, you actually receive supplemental benefits that you wouldn't receive under traditional Medicare and traditional Medicaid. So those supplemental benefits can really be very important for folks. We have a vision benefit. So we'll pay $100 annually for new lenses or hardware for eyeglasses. And you go to see your doctor as you typically would. There's zero copay for a vision exam. We have an over-the-counter benefit of $80 per quarter. So you can order items in a catalog through CVS that are covered under this over-the-counter benefit, and they're just drop shipped directly to your home. And that can be things like aspirin or allergy medicines, Band-Aids, even a scale. I think we've got scales. There's all kinds of things in that catalog, and that's just a nice benefit that you don't get with traditional Medicaid and Medicare. The other types of benefits, we've got a free gym membership. So you can go and work out at a Silver and Fit gym, which is a nice benefit to talk about, health prevention. We've got a podiatry benefit. We've got a meal service. So when someone is in a medical situation, they're in a hospital and they're discharged, we can actually have meals delivered to your home, 58 meals per year, to help with that transition of coming from a highly medicalized environment to living back home independently. And those are just a few of the extra benefits that you would see with this plan. And that's not even to mention care coordination. And that's really the cornerstone of this. So I'll let Megan and Sophie speak to that.
So Megan and Sophie, a true benefit here is the ability to call one person with questions. What can that one person do for me? Can they set up appointments? Can they advocate for me? Can they coordinate, through the different care providers? Are these things that they can do?
Yeah, I can jump in here. Our care coordinators, we have care coordinators that are connected to every member on our True Blue Special Needs Plan. And really the goal and ideally that care coordinator will be working with that member through their length of their enrollment with us. And like I mentioned before, members can enroll every month. And upon that enrollment, that care coordinator is making outreach within that first 10 days that they have decided to join our plan. And really the care coordinator is that central point of contact. They are working to connect with you as a member, to learn about you, your history, your social history, your medical needs, maybe just areas of interest and preferences of care, so that they can help connect you with the available benefits for you, and also maybe address, like we talked about before, gaps in care or areas of need that may extend outside of Blue Cross, but connect within the community, resources within the community that might help identify or help address certain needs that you have. Really, that care coordinator is there for certain touch points based off of your needs and and things that may come up for you, but also available to answer questions, to connect you with services that or benefits that you may not be aware of. They can help coordinate some appointments. They can help, again, connect you with resources within the community. If they receive a question or some kind of a challenge and the member's not quite sure where to go, that care coordinator there will get every information that they can and then follow back up and really help that member navigate through what is available to them.
So can you explain the bill to me when I get one?
They sure can try. They can also connect them with other team members within Blue Cross through customer service, can also kind of maybe try to get some more details, either connect them with their provider for some more follow-up and information, really walk them through their health services. Another thing that our care coordinators also try to do is also try to help engage and maybe help educate the member on some of their own resources that are available, so that the member is then empowered to be a little bit maybe more involved in their healthcare services or their needs.
Okay, very good. That's quite a bit.
I'll also add, our care coordinators, like Kristen mentioned, are local throughout the state. Our team spreads across the state of Idaho. So we also are pretty proud of that. We think that it's important that our care coordinators live in the same communities that our members live in, really connecting to those community needs, those resources within the community, and really being on the same page and by the side of our members where they live.
Okay, very good. So I don't see a downside for engaging in this, except maybe if they have a doctor, whatever, that they can't access through one side or the other. Is that really the big downside, if there is one?
And I don't even know if I would call it a downside. It's just something that we want people to be aware of, to ensure, we've got a lot of great doctors and a very large network, but I think that those are two things that I really like people to pay attention to, to be fully informed before they sign up, which providers are in network and which of their pharmacy drugs are covered. And as Sophie said, they can join, and if it's not the right fit, they can opt out too. So they're not stuck into a plan for an entire year. We have a quarterly disenrollment, so they can, if they get into this and they decide, it's not, exactly what I thought it was going to be, or it's not right for me, we are not here to make them stay. We want to support people as much as we can, and that includes their decision to stay in the plan. And so we have the ability to, people can disenroll on a quarterly basis, and they can either choose a different payer. And we've talked a little bit about that. There are only 2 payers in the state of Idaho that have that contract with Department of Health and Welfare. Blue Cross of Idaho is one, and Molina is the other one. So a member could choose to go to Molina if they want, or they could go back to traditional fee-for-service. But if they live in one of those 30 counties, that's when Idaho Medicaid Plus comes into play, and they would probably be assigned to either Blue Cross or Molina for that.
Very good. Blue Cross, of course, does not have complete control over who's in or out of those systems, right? You can't force a doctor or a medical group to be in system.
That's correct. We have a contracting team that goes out and works with all of our providers to get them to decide if they want to be in network and contract with them. And currently our plan operates under the Medicare Advantage network. So we do have a wide network of doctors that individuals can choose from.
Got it. And so if they get hung up, then a couple of options. One is to say, no, I'm going to stick with what I got. I'm going to give up some things, but I want to hang here. Or they could work with a care manager who says, well, maybe we could find another care provider for you. And we happen to have a handful to choose from. Okay, more than a handful, maybe several handfuls to choose from.
Yeah.
But that would be something you could bring to the table.
I think another important thing to point out is that when members do decide to enroll, contractually, we have a 90-day transition period in place. So there are times where someone comes on the plan and we've identified that, they were just about to have surgery with, Dr. Jones, and Dr. Jones isn't part of our network. So at least within that first 90 days as well, we are covering services because they were already in place. We're kind of continuing that care. The other component is that if we do identify a member is receiving services from a provider who's not part of our network, that does go back to our contracting team. Kristen mentioned them. They're amazing. They work very hard to outreach to those providers to help them understand that, I know you're not part of our network now, but we just had Susie Smith enroll and she uses you. She's been your patient for 5 years. We'd really like to have you join our network. So that's another component that is kind of that safety net for members that, if for some reason, they looked up information or, they thought or maybe they just assumed that the doctor was in network and they're not, we can really help them navigate that. At the end of that time, or once we, engage with the provider and they ultimately, give us that decision that they don't want to join our network, that is where that care coordinator can come in and really help the member identify, another specialist that can still meet their needs, help with that referral network and coordinate it back to make sure that they're still getting the services that they need.
Very good. So certainly this is information that those that are dual eligible, and most of them know who they are, right? And most of them know that this program is out there because you ladies are doing such a good job, right? They just know. Other than those folks that are dual eligible, who else should be aware of this? Are there family members or neighbors or friends, care providers? Are these people that can, kind of push them along a little bit?
Certainly, yes. I think there's that's part of our strategy is to ensure that Idahoans understand what we're doing, and that these tax dollars are really being spent in a very, very stringent way, and in a way that maximizes actually benefits for members. And I work with caregivers. I work with family members. Well, when I say caregivers, I mean formal and informal. So paid caregivers and family members. I think members of the community, again, folks who work within agencies that serve this population, it's really important that we educate them. And I would love everybody to just be talking about the True Blue special needs from our rooftops. It's an important plan. It really modernizes healthcare and ensures that the member is right there in the center of everything that's happening, with the care coordinator right there to the right-hand side, and that care coordinator helps them navigate.
Well, I think they should be doing it from the rooftops, but not today. They recorded gusts of 53 miles an hour overnight. That's a lot of wind, so don't get up there today. So somebody has a question about this, whether it's somebody that's not sure they're dual eligible or somebody close to somebody that's dual eligible. How do they find out more?
If they have internet access, they can go to Idaho True Blue SNP, and that will bring them directly to our website that talks about the True Blue Special Needs Plan. They can call customer service. Let me get to that number really fast. That number is 1-888-495-2583. Or folks can call me directly. I've got a phone on my desk, and I love to be able to talk to people about this plan. My number, my direct line is 986-224-8255. 3045. A lot of times I'm not there, so maybe that customer service number, if you can't get a hold of me, call, or if you don't have internet access. Megan and Sophie, if you've got any other suggestions. Oh, also brokers. Brokers are a good place to start too. We do work with brokers, and again, there's no cost to a member to work with a broker.
Okay, Megan, Sophie, anything to add to how to get hold of you folks?
I think you covered it, Kristen. I mean, for prospective, individuals who are interested in learning more, those are great avenues to, be able to get a hold of somebody and get the information that you need to make an informed decision.
Okay, so give us the website again.
www.idahotruebluesnp.com.
And
Or you can
SMP
go
stands for Special Needs Program, right? True
Yes.
Blue Special Needs Program, but you don't have to spell out all of it, just the True Blue part.
Correct.
Okay.
Yeah, or you can just Google Blue Cross of Idaho, and that will bring you to our page. And near the bottom of the page, you're going to see 4 boxes. And I think the third one over will say Medicare, Medicaid. Just click that box and it'll bring you right into that the Idaho True Blue Special SMP.
Give us those phone numbers again.
Sure. Customer service, 1-888-495-2583.
And if they
Or you
don't
can call me
remember that
direct.
number, because that's a long number, but if they don't remember, if they can Google Blue Cross, they're going to run across that number, right? So they don't have to memorize it. They don't have to worry about not
Correct.
having written it down. They can get there.
Right.
Okay.
That
And
is,
then your
yes,
phone
that's
number.
correct. My phone number, 986-224-3045. And I want folks to just know that if you do call customer service and you want to sit down one-on-one with an outreach or engagement specialist, tell customer service that, because we have folks up north, we've got individuals in the east, and I cover this area with a counterpart. So let them know that you would like to speak to someone in outreach for the DSNP plan, and we can contact you directly. Maybe we could do a Zoom meeting, or if you want to meet at a coffee shop or something, and we can talk face to face.
Okay. Anything else you want people to know about this program that maybe we haven't covered or covered as well as you think we should have? Is there anything else?
I think the only thing that is valuable, we talked about, why somebody would be interested, having a care coordinator be there to be their advocate. COVID has kind of transformed how we're engaging with members, but typically, we are in their local community, and when we're outreaching them to try to learn more about, as Megan mentioned, their social history or their medical history, if a member is open to it, that care coordinator will meet them at their home as well. So it's not just a telephonic conversation. So right now we are engaging telephonically with members in the interest of public safety and to make sure that everybody is safe. But once we're able to transition out of that, we will return to having that face-to-face, that in-person connection with members, which I think can be really valuable. Being able to have that visual connection, go to a member's home and possibly pick up on, safety concerns, that they may not even be aware of, but that, qualified health professional who's a care coordinator can help provide them some education on, I think is really valuable. So that's a big important component. That in-person is on, again, our True Blue Special Needs Plan. We really will, as long as the member is open to it, we want to see them face to face so we can, build that relationship.
Well, yeah, and when you're talking to people my age and older, you want to make sure that they can understand you, because they're going to read your lips because they can't hear anymore.
Well, I think health literacy is huge in general. It's very big with this population, and visually being able to identify that you're telling somebody something about their health condition, and if you can see them, you might be able to know they're not understanding the words I'm using. They're not connecting those dots, and that can be a little bit more challenging telephonically. So those in-person assessments, I think, are a really valuable component of the program.
Oh yeah. Anything else we should tell? So this podcast goes out especially to my clients, but it's also available for lots of people to download or to view. Is there anything else? Did we cover? So here's the deal. We're gonna hang up, and in about a half an hour, you're gonna, oh, I should have thought about this. We should have talked about this. So I'm just giving you an opportunity to not worry about that later, and just if there's something you can think of that we should know about Blue Cross of Idaho, the dual eligible program, anything else that we should let folks know while we have an audience.
I think we covered really the basics of our plan, but I would just add, earlier in this conversation, you asked what the downside is, and I would say there really isn't a downside to joining our MMCP plan. And in fact, it's the opposite. There's just more services, more benefits available, and really that care coordination piece is the cornerstone of what we do, and it really is a great service and a great connection that we provide to our members. We have a great team.
Yeah,
we have a great team of care coordinators that really love what they do and really love to work with the people in our communities.
And it doesn't cost them any more to do this.
Nope.
It isn't going to cost. So that's something that I know people get concerned about, but that is not a concern here.
No, I think maybe just detailing it a little bit more. Kristen mentioned on that, it's a zero premium plan. If they pay a small copay for their drugs today on traditional Medicare, that would continue if they sign up for the plan. And then the other item that she mentioned was a share of cost. So a large portion of our population, they have qualified for Medicaid. Back in the beginning, we talked about how people can qualify for Medicaid. You're either qualifying because you meet the income requirements set forth by Division of Welfare, or you may also qualify based on a medical need. And typically you're exceeding the income or asset requirements, but your medical need is so great that you've qualified for Medicaid. And there's a specific subset of Medicaid covered services, some of those in-home community-based services where maybe a caregiver is coming in and helping you get dressed every day, or making your meals. So some of those services, a share of cost applies on a monthly basis, and that carries over as well. But that's really the cost, and those again aren't cheap.
So no more than they're already paying.
Correct.
Absolutely.
All right, very good. And it was a trick question. There is no downside. They really need to look at this. And I know that people get attached to their care providers. And so I guess they could lobby the care provider to join the network.
Mm-hmm.
Or, the possibility of finding another care provider that, is within the network, and so that they're covered. Well, listen, thank you very much for joining me this afternoon. This is just tremendously good information. And I can see where, the drive is to get this information out there, get it into the hands of the folks that can benefit from it. I didn't see a downside. And as an attorney, I'm trained to find the downside, right? That's my job. People come to me, they don't want any risk. So, tell me what the downside is. And there isn't really one here. So very good. Thank you very much for joining me. Have a lovely day, and hopefully people will pick up on this and give you a holler and get engaged. That'd be great.
Thank you for having us.
Take care, everybody.
Thank you so much.